Want to make your breasts bigger but you don't want to use an implant? Well, fat transfer might be an option for you. Stay tuned to the end of this video and I'll tell you how much it typically costs. I'm Dr. Barrett, I'm a board certified plastic surgeon, and I do a lot of breast augmentation procedures, both with implants and with fat. Obviously, I'm still doing both of them, so there must be a reason why I use fat for some and implants for other. Well, in general, for fat transfer, there are a couple prerequisites that you need to make sure that you have a successful operation. One, you have to have enough fat to take from somewhere to transfer to the breast or to whatever area you want to make a difference. If you're very skinny and you have very little body fat, fat transfer might not work for you. The other condition that you want to have is to make sure that your goals are realistic. With fat has a mind of its own, whereas an implant is very form stable. Okay, so this is 320 cc's. 10 years from now, it'll still be 320 cc's. Fat is a liquid. It can make things bigger, but generally retains the shape of the natural structure that you're putting it into, whether it's the buttocks or the breasts. It does lose a little bit of volume initially, anywhere from 30 to 40%. So a lot of people come out, they're like, wow, this is amazing. And then the results go down right around the 3-month mark and they're sad. But they still have a net gain of about 70 to 60% of whatever fat we did transfer. On average, results, we typically get about a half cup size improvement for every round of fat transfer that we do. And yes, some people do multiple rounds of fat transfer. As opposed to an implant, you only need one time and the job is done. Fat has a memory, so if you take it from the love handles or a particular type of area, it will retain that memory. So if you gain weight in those areas, your breasts will get bigger. If you lose weight, your breasts will get smaller. So like I said, fat has a mind of its own. An implant is a lot more stable in terms of what your predictability is going to be. But if you don't want to have the cons of an implant, meaning that you have to replace it, you have to get maintenance, the implant associated complications that you can get, then fat might be a good option for you. You all also wanted to know how it's done. Well, basically it's a 2 combination procedure in one. We do liposuction of the area. I do what's called a safe liposuction technique, meaning I take the fat out very carefully, not on suction, so I don't create contour irregularities from wherever we take the fat. We purify it on the back table very quickly, and then we put it gently back into the breast. Lots of small, tiny little droplets so that the breast has the most ability for that fat to survive. It's basically, if you take a big bag of seeds and you put it all in one spot, it's not gonna grow very well. If you take each one of those tiny little seeds and you spread it out through a big giant garden, then you have a better chance of the fat surviving. The cost of this procedure ranges anywhere from $15,000 all the way up to $30,000, basically depending on how much liposuction you want to get. If you're just looking for the bare minimum, a lot of times we can do inner thigh, or we can do just the love handles if you have enough fat, and then do the fat transfer procedure to the breast. Implant surgery ranges anywhere from $8,000 all the way up to $15,000 depending on where you go. Let me know in the comments if you'd ever consider getting an implant or fat transfer for your breasts. And if you have any other comments, questions, feedback, let me know in the bottom down here and I will get back to you. Feel free to hit the thumbs up and subscribe if you want to see more cool videos just like this. Thanks for watching.